All right, everybody. Tonight we're going to hear from Dot Mitchell. She is a registered nurse. She has a Master of Science in Nursing. She has an MBA. She is a Lieutenant Colonel, retired from the U.S. Army Nurse Corps. And, she owns a laser med spa for years. And if there's anyone who knows on the inside and out of the skin and what to use and the effectiveness of different types of machines and equipment they can get to enhance your skin, it's Miss Dot. So I'm going to pass it right over to her.
Okay, thank you. So just quickly, I have been using the commercial version of this for about 15 years, and it's an amazing product. It is an ultrasound device. It's used to stimulate the skin. It's used to clean the skin, and it's used to ultrasound products into the skin. And one of the things that you need to take a look at is, if you can see this, the blade that you have on this device curves down until you turn it up in the opposite direction, then it curves up. So the important thing to do is when you're using it to clean the skin, and I think this is where some of the confusion has been, you would wash your face. It doesn't matter what you use. Hopefully you'll be using our cleansing device. Our cleansing product. And then you use water. You can use, I have a little spray bottle of water. So what I was doing is spraying it on. You can use cotton balls. You could just splash water on your face, whatever you happen to be doing, but spray water. And you want a lot of water after you wash your face. And then you're going to take the machine, push the button, and then with the blade down, you're going to go very gently across your face. You're basically skimming it across your skin. You're not putting any pressure down. You're going to be cleaning up in this fashion, or you can clean across. The important thing is the device is spinning water into your pores at about 20,000 cycles per second. It's causing any kind of debris that's in your skin to be flushed out. You'll see the blade will get a little grungy. You'll see blackheads come out. You'll see whiteheads come out. If you're doing it on acneic skin, you can clean someone's face with acne. It's just marvelous. And then you're just skimming across. When it seems as though your face isn't wet enough, just re-wet it, because you really do need water as a vehicle. And then the areas that work really well are the chin. If you have a lot of congestion in the chin, which people do, hormonal acne around this area is really amazing. Around the nose, if you have blackheads or large pores, you're just going to clean like this, like this, like this, like this. And then when you're finished cleaning, all you have to do is then take your product, and I would take a Luma Boost first, or I would take the, what's this called? This is a hydrating facial mist. You can use either or. Put it on your face, just splash it on like this, and then turn the blade around so the blade is facing upward. And then with this fashion, you're going to just move it, and you're going to ultrasound. You're basically ultrasounding all of these products into your skin. And that's the whole method behind this. You want to make sure that you're using water-based products first, because your skin is going to be able to accept any product that you put on your face. So you put the water-based products first, so they can be penetrated into the skin, into those microchannels that you created. And then you're going to use gels. So that would be the, where is it right here? My new favorite, the SIGS 1273. And it goes right in. You'll find the more that you use this, you'll find that your products disappear, because your skin is so able to accept the products. So then you're going to, again, with the blade facing up, so you can ultrasound it in, you're going to do the same thing. Again, up, 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 like this, because you want to fight gravity. And I'm basically ultrasounding in this wonderful SIGS 1273. And then when I'm finished doing this, you can actually go across your lips with it. You can clean your lips, you can clean your chin, and you can ultrasound all these products into these areas. It's great for the smoker's lines or the laugh lines that you have here. You can definitely penetrate here. So it's perfect for anyone's skin condition. And the third product you might want to put in is the day cream. I am not sure. They did mention that you could use the night cream, but honestly, that needs to be checked out with corporate. I wouldn't do it because your night cream is meant to be sitting on the skin as a sealant. And I don't think that, I would not be ultrasounding that into my pores. I think it's really meant to be on the outer surface, but that's something that has to be clarified. But again, water-based products, lotion-based, gel-based products, and then lotion-based products. And that's the order that you should be doing it. And that's pretty much it. What you'll find is your skin will feel like baby soft. Anything that you put on your face for a couple of days to a week after you do this treatment will be absorbed, especially if you have a person who has acne. The other thing that you can do once you clean the face is you can put the acne pads and just wipe their face with maybe 1 or 2 acne pads, because that will really penetrate all of the ingredients from the acne pad, and then do the water-based, gel-based, oil, and lotion-based. And you will have a very, very successful treatment.
And how often should you use it, Dot?
You could use it daily. I think to start off, maybe a couple of times a week until you get the hang of it. You don't want to overdo anything with your skin. If you're accustomed to using these products and you're using them on a regular basis, you probably won't have an issue. But if you have a new customer who's starting to use Neora products for the first time, and they may have been using other less beneficial products, it may be too much to be doing it on a daily basis. So you may want to have them just start off a couple of times a week. And I think, and again, that has to be checked with corporate, but that's the way that I would be doing it if I were telling people what to do.
And is there a morning, evening, better time to do it?
Whenever you want to, it doesn't really matter.
And how close under the eyes can you get?
You can actually go very close. I like to go right under the eye. And one of the things that I do is I wake up every morning and I have these big sausages under my eyes. And I used it the other day, and I just went like this, and it minimized it's like lymph. If people have big baggy eyes in the morning when they wake up, you can just tap it like this, and it helped to dissipate the fluid that was under my eyes, which I hadn't seen in like forever, because I used the use the eye cream, the eye serum rather, on a daily basis, and I use the eye pads maybe once every couple of weeks, because I just don't have time to think about it.
And rosacea and eczema, are those okay to use with this?
Yeah, absolutely.
Acne is?
Yeah, rosacea, acne, eczema. One of the things that this, because of the ultrasound and because of the stimulation, at least from the device that I have, which is really similar, it's like the same. This also helps to sterilize the area too. So for people who have acne, it works very, very well. If people have really pustules, you may want to be careful, but I'll still go over patients who have pustules and really clean their skin out, because one of the reasons that a lot of acne meds don't work is because you can't get through the pustules and the blackheads and the whiteheads to penetrate the products. And this is what will allow you to do it. What else?
Great. And can you do the neck?
Oh, absolutely. The neck, and then start from down here. Yep. I would totally do. I do the neck when I do a facial. I go all the way down to the décolleté. You can do the décolleté also.
All right, great.
Yeah.
Beautiful. All right.
It's amazing. So just, again, the sequence of products is really the most important, because if you try to put a thick cream on and ultrasound it in, and then you try to put a water-based product, it won't go through. So water-based, gel-based, lotion-based, and then oil-based products would be last, but we don't have anything that's oil-based, so not to worry about it.
All right. Thank you so much.
You're welcome. Thank you.